Okay, you can go.
All right. Hello, everyone. We are very excited to have been invited to speak tonight to our OPAC listeners about an incredibly important topic, and that is a new normal supporting teens with cancer. One second. I'm sorry. My cat has turned on some music. She likes to play with the speakers. All right, everyone. So back to it. So my name is Becca Côté, and I am the clinical nurse program coordinator at Teen Cancer Connection, which is a program that we have at SickKids, SickKids being in Toronto. And I am a registered nurse by background. I previously worked in inpatient pediatric oncology for a number of years before transitioning to this role in August of last year. So it's been about 1 year that I've been developing a new program at SickKids. And I'm here with my lovely colleague, Benita, and I'll let Benita introduce herself.
Hi, everyone. My name is Benita, and I am a social worker at SickKids. I am developing a new initiative at our hospital called the After Cancer Treatment Initiative, and this is really to provide support to our patients and our caregivers who have completed treatment. It is fairly new, but we hope to talk a little bit more about it throughout our session, but we'll dive right in.
So Benita and I do work at SickKids, and the programs that we work with are designed for SickKids patients and families, but we are aware that we do have a number of OPAC families who have children who attend other centers in Ontario for their child's cancer treatment. And so while tonight we will be talking a little bit about some of the specific things our programs offer at SickKids, we also have designed our presentation to include information and resources that can be applicable to families and teen patients who do not receive their care at SickKids.
Great. So today, this is just a brief overview of what we will be going over. Main portion of our conversation today is going to be talking about the unique needs of teens with cancer, both on and off treatment. We'll be discussing the supports that we have for our teens on treatment, specifically the Teen Cancer Connection, and supporting teens off treatment, so with the After Cancer Treatment initiative, and then we'll also be talking about some tips for our parents of teens.
So first, I'm going to talk a little bit about adolescents and young adults in general and their development. I do know that I am talking to a group of parents, and so you guys are absolutely the experts when it comes to your children. I really do believe as a healthcare provider that parents and the children themselves are experts when it comes to their care, and so really important that we listen to them. But circling back to the idea that we really need to understand the development of a teenager to see how cancer uniquely impacts them. And so linking back to that, the importance of understanding development as it pertains to teens, young adults is crucial to understanding cancer. So when it comes to this term here, the adolescent and young adults, or AYA, I'm going to be using that term frequently throughout the presentation just to refer to this age range of teenagers and young adults. In the literature, there are a number of different age ranges that we use to refer to the AYA period. So oftentimes in North America, we're looking at the age range of 15 to 39 years in healthcare to refer to an AYA. Here at SickKids, we do use a little bit of a different range. So we're looking at 13 to 18 plus years old because we do want to encompass all of the teenage years to really understand that being a teenager is a unique experience, and there are unique developmental and informational needs that a teenager has. We also do have patients at SickKids who receive their treatment here after the age of 18, and so we don't want to exclude them in the age range that we're talking about. And so just being cognizant of the fact that we will have young adults that we are treating as well. Something that's very exciting in recent years is that literature and healthcare are recognizing AYAs as a distinct group of patients requiring specialized care. And so we're starting to see more areas in healthcare pop up that are trying to provide unique care to the AYA population. And that is really influenced by the developmental milestones that adolescents and young adults experience and how that needs to inform the care that we have. And so when all of this is done and done, we really need to look at the developmental milestones in adolescence. Um, when children are young, when they're infants, there is a huge period of growth and development. They are learning lots, they are growing lots, and then it tapers off a little bit for a period of time until really the next big period of development, which is adolescence. So there is a lot of development and a lot of growth and a lot of change that happens during the adolescent years. So some of those changes are cognitive. There is a lot of brain-based development that is happening for teens and young adults. The brain continues to develop well into the young adult years. And so they are really trying to experiment with abstract thinking. They're trying to reason. They're really trying to think in different ways than they were able to before. On an emotional level, teens and young adults are really experiencing a wide range of emotions. They are really dealing with a lot going on in their lives and learning to self-regulate those emotions as well. They're also learning to think about the emotions of other people and how empathy plays into that. When it comes to social developmental milestones, this is a crucial time for social development for teens and young adults as well. And the main area right there is identity formation. So teens are really trying to gain independence and figure out who they are and where they belong in the world. And so really trying to figure out what their identity is. And so with that, they're oftentimes exploring various relationships and changing relationships. So that can be changing relationships with their peers and friends, changing relationships at school. We see them starting to have romantic partners and explore relationships there. And then changing relationships as well in the family. So family dynamics can start to change, and there might be a little bit more conflict or changes that they had with the relationships with siblings and parents. And then, of course, physical development. So there is a lot of growth and physical change that happens in the adolescent period. We're talking about puberty here. Many changes come with puberty that can also lead to changes in body image. Teens are also requiring more sleep than they needed before and are having changes in the physical activity that they're participating in. And so now let's add a cancer diagnosis. Being a teenager is incredibly tough. It is incredibly tough before cancer is even in the picture. And then adding a cancer diagnosis doesn't make being a teenager any easier. This is a common diagram that we often use when talking about AYAs and the many life disruptions that happen when a cancer diagnosis occurs. So teens with cancer might be upset by the disruption of school and their activities with friends. They might be upset about changes in their appearance. They might feel that their independence is threatened. Sometimes teens show intense emotional responses to a cancer diagnosis. They at times focus on the meaning of life and cancer's effect on their identity. Remember, identity formation is really important. Sometimes they're taking risks that could cause problems and friction within a family, and that might mean that they're rebelling against parents, doctors, and treatments. They often also focus on how cancer changes their lives, their friendships, their appearance, their activities. They might be scared and angry about how cancer has isolated them from their friends. And so we look at this model here with the life disruptions of an AYA. Sorry, that's my cat. And there are a number of areas that are really affected. These are common things that would be challenging oftentimes to a teen on its own. Some of them, not all of them, but cancer makes it even more complicated. So there are financial disruptions to the entire family unit. Parents might be needing to take time off work to take care of a teenager who is receiving cancer treatment, and that can change the family dynamics as well. So the roles that people play in their family can change education and employment opportunities. So teens are going to school, and having a cancer diagnosis might mean that they need to take time off school or need to reduce their course load, which might impact when they're able to graduate and change their ability to take classes with their friends. It might alter what their career path is going to look like later on. Being a teenager is often also a time when you're getting your first part-time job. And so cancer might take that away and not give you the opportunity to have a part-time job. It disrupts future plans. So planning for the future, what you're going to do after school, what activities even in school you're going to be involved in. Are you going to play sports? Can you play sports anymore? Do you want to do art, but do you have the energy to be involved in art club? And so it really makes you think about what your future is going to look like. With future plans in mind, we also oftentimes in cancer care look at fertility. And fertility is not often talked about, but is something that is incredibly important and something that I think that we really need to be talking about more. Not all cancer treatments, but some cancer treatments do have an impact on one's fertility. And so the chemotherapies, the radiation, the surgeries may impact a teen's fertility later on in life. And we do know that teens are most likely going to survive their cancer. And we want to be sure that we set them up later in life to be able to meet these future milestones and these future developmental stages and participate in society. And so having conversations about fertility is incredibly important, especially because teens oftentimes aren't even considering whether or not they want to have children. It might not have been something that has crossed their mind. And now a cancer diagnosis is making us take a step back and think about something that they haven't thought about yet. It can also be very awkward to talk about fertility. Providers find it awkward, families find it awkward. And so that's another area that we really need to consider when we're talking about how an adolescent copes with cancer. Cancer disrupts peer relations. They're not able to hang out with their friends as often. When they have a compromised immune system, they might not be able to see friends. They might not be able to partake in social opportunities that they would have been doing before and seeing their friends less often. And so the way that they interact with friends is quite different. Friends might also not understand what it means to have cancer. Oftentimes, peers at that age, their experience of cancer is usually with people who are much older. And so it's very hard for them to understand what it means to have cancer as an adolescent. And so that can cause friction in the relations that teens have with their peers. Changes in health behaviors. So oftentimes teens are going from being a healthy teen to suddenly having to take multiple medications a day, coming to appointments, taking care of their central line, and that can be quite a challenge. In terms of self-esteem and body image, cancer causes multiple changes to the body, which can impact self-esteem. So we always think about hair loss, but there are many other things as well that we need to consider when it comes to body image. This could be weight gain or weight loss. It could be scars from surgeries. It could be amputations. It could be having a central line or a pick and what that means for their body image. And so these are a number of the life disruptions that teens and young adults are experiencing, and something that we just really need to be cognizant of when it comes to how we interact with teens. There is one thing here also about trust and health. And so this is something I'm going to talk about again a little bit later, but when it comes to teens and young adults, they are often diagnosed later than younger children would be with cancer. And so that comes from the idea that we usually don't expect that when a young person in the adolescent to young adult age range is sick, we don't immediately jump to cancer. We expect them to be healthy. They've been healthy before, and we run through different diagnoses before we usually arrive at cancer. And so sometimes there is a late diagnosis that can contribute to mistrust of the healthcare system. Another area that I see oftentimes with teens when it comes to mistrust with health is that a lot of the information in hospital is being discussed with parents. And so teens are aware of what's going on. They're aware that something is wrong with them. They're aware that conversations are happening without them present. And so there can be mistrust with family members. There can be mistrust with the healthcare team because information isn't being spoken about with them and they are not being included in decisions about their own healthcare. And so this often relates to the idea that teens feel like they are stuck in the middle. So this image right here is to show you that the average age on a pediatric oncology unit in Canada is 4 years old. And then the average age of an adult oncology unit is 60 years old. And so you can see where that age range of 13 to 18 plus is really feeling like they don't belong. They're stuck in the middle between two healthcare systems. They are much older than the younger children that you're seeing in a pediatric setting, but they are much younger than the older adults that they are seeing in an adult care setting. And so really trying to figure where their place is, and that can often also lead providers to be unsure about how to care for this in between age range. With that in mind, we think about the two mindsets. So teens compared to children are better able to understand the severity of their illness. However, this can lead to a risk of persistent distress related to relapse, late effects, and thoughts about death. And then compared to older adults, they have fewer emotional, practical, and informational resources to help them cope with their illness. So there are a few differences really when it comes to AYA cancer patients, and a lot of this stems from the unfortunate reality that there are fewer improvements in survival rates for adolescents and young adults than there are for pediatric cancer patients. And when I refer to pediatric, I'm meaning, in this case, younger than the age of 13. This is often due to the fact that adolescents and young adults have more aggressive cancer biology. There's lower clinical trial enrollment oftentimes for them. There's a longer delay between symptom onset and diagnosis, which I previously talked about. And all of this said and done, even though there are fewer improvements in survival rates, we do know that based on treatments that are available now and ever-changing research and scientific discoveries, we are seeing overall an improvement in cancer survivors and seeing more cancer survivors. And so when it comes to treating cancer, we need to be aware that there is a risk of late effects, which include infertility and secondary cancers when we're treating cancer. And that's important when we're looking at how AYAs have cancer therapy and then what things we need to consider later on in life. And so this then leads me to the Guerin Family Psychosocial Program at SickKids. Cancer research shows that patients without good psychosocial support networks tend to do worse medically. They have more depression, more anxiety, and less compliance. And this shows us really that a lack of psychosocial support actually has a negative effect on medical outcomes. The Guerin Family Psychosocial Program is a SickKids specific program. However, there are psychosocial supports usually at most centers. This looks like child life or social work or psychology or psychiatry. And so just being aware that while we have a fancy name for our program, there are other providers that do provide psychosocial support at other centers that are not SickKids. So from the Guerin Family Cancer Center, and the psychosocial program, I, in August of last year, started a new program called Teen Cancer Connection. And so Teen Cancer Connection is a program for adolescents and young adults, recognizing that they do have very unique needs and they do require care that is different from the younger children that we're seeing at SickKids. And so the program is comprised right now of myself, a registered nurse, and then a physician who is an adolescent medicine physician. And we provide support to teens with cancer, and this is based on their unique developmental and informational needs. So the main goals of Teen Cancer Connection are to help identify the individual needs of each teen and young adults. And we do this by meeting one-on-one with teens, usually without their parents present, to give them a space to talk openly. We then provide the teens and young adults with education and psychosocial support that is specific to their unique needs, and then link them to relevant hospital and community resources and services. We also, as part of Teen Cancer Connection, really want to be connecting teens with other patients who are going through something similar to try to build peer connections. And then another really core aspect of Teen Cancer Connection is collaboration with the interdisciplinary team to support adolescents and young adults. So while I have started this program called Teen Cancer Connection, psychosocial care of teens is not one program's role. It really is everyone. And so we're collaboratively always working together to be able to provide support for teens. So some of the conversation topics that I discuss with teens when I meet with them are from the Children's Oncology New Diagnosis Guide for Teens and Young Adults. So oftentimes when a family comes in, there's new diagnosis teaching at SickKids that uses the Children's Oncology Group Guide to talk about some of the topics like central lines and blood counts and monitoring for fevers. And there is an accompanying guide that is specifically written for teens and young adults based on some of the concerns that they might have. So some of the topics that I frequently talk about include sexual health and dating, fertility. I talk about managing side effects of cancer treatment, but really as they pertain to the unique needs of teens. So in regards to bleeding, I'm oftentimes talking about how to shave safely or brushing your teeth and monitoring for bleeding with your gums. I also talk about monitoring periods to see if there is an increase in bleeding or a decrease in bleeding. When it comes to constipation, I talk about moving your body and getting adequate hydration to help things flow. Talk about nausea and little strategies that teens can do to manage nausea with regards to medication, but also things like eating colder foods and eating smaller meals. I talk about fatigue and managing fatigue, and then also strategies for pain management. In regards to body image, I do a lot of body image counseling. I talk about hair loss and coping with central lines. I talk about scars and amputations. Socializing and talking to friends about diagnoses is something that is a very common concern that teens have. Oftentimes they don't know how to talk to their friends about having a new cancer diagnosis or a new development in their diagnosis. And so sometimes they talk about strategies of having those conversations and also managing expectations of having friends throughout treatment and keeping good friends around. I have conversations about navigating school. We also have an incredible interlinked team through the POGO organization. And so oftentimes I'm liaising with the POGO team to help make school an easier transition. I do talk about substance use and the risk that various substances and alcohol have on the body and how they can interact with some of the medications that teens are having and talking about safety there. I talk about coping and mental health, and then I talk about also sun safety. So ensuring that people are wearing sunscreen and protecting their head from the sun, especially when there is hair loss. And so things that teens might not consider. When it comes to tattoos and piercings, some teens are interested in tattoos and piercings. And so I talk about the safety and the infection risks that come with tattoos and piercings and when might be a good time to do those or when it's not safe to do them as well. And so I do this by means of something called the HEADS assessment. And this is not a SickKids specific assessment. This is something that many healthcare providers learn to do. And so this is something that healthcare providers at various facilities across Ontario and Canada and the world are able to do when assessing teens and figuring out what their unique concerns are and where we can provide more education. And so that's looking at home, education and employment, eating, exercise, and body image, activities and socialization, drug and alcohol use and smoking, safety. Safety, I talk about sun safety, I talk about driving, I talk about caring for pets while on cancer therapy, and I oftentimes talk about tattoos and piercings here as well. And then sexuality, this includes sexual health, but it also includes fertility preservation and dating. And then I talk about support to mental health and coping. And then the next part of Teen Cancer Connection, as I mentioned, is connecting to resources. So there are a number of resources out there, but some of my favorites and some things that are really great for teens to be involved in include Look Good, Feel Better. So this is an organization that looks at doing makeup classes and hair and wig classes for females who are undergoing cancer treatment. It's specifically for teens. It's offered virtually right now, and they provide makeup kits to help tackle some of the body image challenges that teen girls are facing during cancer treatment. Teens for Teens is a group that we have at SickKids right now. It is only offered to SickKids patients, and it is virtual as well as in-person drop-in sessions for teens to meet other teens and be able to talk about regular teen things that are not related to cancer or about cancer. Whatever they're feeling, we try to facilitate conversations that way. Photo Voice is an excellent group that has traditionally been run at SickKids for SickKids patients by social workers. It looks at exploring the cancer journey by means of photography and therapy through there. Campfire Circle is another organization that I'm sure many of you are familiar with that does a lot of actually very specific teen training and teen programming. And so there are leadership opportunities for teens. There are actually volunteer service hours that they can get. And there are teen specific summer camps and weekends away. And then also you can actually get a summer course. So a school credit can be given through there. And then two of the other things that I often refer to is on the SickKids psychosocial website, there is a resource list under the Teen Cancer Connection subtitle, and it's a resource list that I've created with various subjects that teens oftentimes have concerns about, with various links. So there's one about exercise, and there'll be a number of links about exercise related to cancer for teens. There's a section on mental health, there's a section on body image, and so that's really helpful to refer to teens so they can get various support for things that they are concerned about. And then the About Kids Health teen specific cancer pathway is also very good and has a lot of links as well. So this is just an example of some of the Teens for Teens programming that we're doing at SickKids right now. We're trying to do a mix of in-person and virtual. So our next virtual one is going to be next Wednesday, actually. And we're trying to do a mix of in-person and virtual to meet the needs of teens, get as many people coming out as we're able to, and then also be able to reach more. I feel very strongly that teens need a space for themselves, and SickKids is often very younger children centered. And so we are very fortunate that in the Sears Cancer Clinic, we do have a room that's specifically for teens. We're constantly trying to change it, make it more teen friendly, but there is a room that's a start, and it's a space for teens to be able to wait for their appointments on their own. Parents, if teens are willing, are able to be there as well, but just a space for them to be away from the hustle and bustle of the younger children in the waiting area. And with that, I'll pass it over to Benita for a bit.
Awesome, thanks, Becca. Yeah, so as Becca has outlined, she spoke quite a bit at length about our teens at diagnosis and during treatment. And now we're switching gears a little bit to talk about the end of treatment with bell ringing and post-treatment as well, and the adjustment that takes place at this period of time. So we wanted to bring back this, this great graphic, this great image, just to depict again of how much cancer can disrupt lives of AYAs. And so as a diagnosis disrupted all these different aspects of a teen's life, adjusting off of treatment can also, there are lots of different aspects that teens are going to have to adjust to, again, especially with these areas. So we just wanted to emphasize all of these different areas again, just as a great image. So adjusting back to normalcy, there's coming off of treatment. Every teen may cope different, adjust differently. Their baseline, their normalcy will look different. Teens have voiced their level of catching up to do after completing treatment. And some of the areas of their lives that they may feel like they have to catch up on are listed here right now. So starting with energy levels and the physical changes of just coming off of treatment, that's something that they're going to have to adjust to, especially if they were on months of treatment, and just understanding what their bodies are able to do, how they're feeling, and what they're up to feel. Many teens have discussed how their energy levels have been impacted post-treatment and how it takes time to adjust after that period. School and employment, as Becca has mentioned, is impacted by treatment. And so coming off of treatment and going back to school, potentially looking for that first job, all of these different aspects around school and jobs will be impacted, and they're going to have to navigate what that might look like for them. Extracurriculars, depending on what they were involved in prior to their diagnosis, they might need to adjust to going back to what that activity looks like now. Part of it might be not having a lot of energy to go play an extracurricular sport, or understanding maybe how their relationships in that team sport or in that team activity looks. So that bleeds into friends and social interactions. As Becca mentioned, it is a difficult area to navigate how to communicate with friends, especially about a cancer diagnosis. And so, completing treatment and moving forward, some friends might not know exactly what happened for a number of months. And so, navigating what those social interactions look like, um, and having those discussions, or maybe not having those discussions around what happened to them, because it is incredibly personal. Coming back home, family role and dynamics might shift, especially as there are less visits to the hospital. What do chores look like at home? How are they feeling at home? Is there an area of safety that they have? Um, and just being comfortable in their space again, and feeling a little bit different after spending a lot of time potentially in different medical centers too. Hospital visits, as I previously mentioned, not coming to the hospital as much, but also starting to process some of what happened at the hospitals, understanding how they feel about coming back to the hospitals for checkups or other further exams and imaging, and understanding how they feel about that. Maybe hospital visits are also associated with teams, and especially if teens had a special relationship or a bond with some of their team members and not seeing them as frequently as they did, they could also be impacted by that coming off of treatment. And lastly, but definitely not, this is definitely not an extensive list or an exhaustive list, but definitely with the emotional processing. And so all of this can happen. The emotional processing can happen at different times. Some teens might want to start processing what happened quite quickly after they complete treatment, but also other teens might want to take a lot of time to start integrating back into what their day to day lives might look like, and then start opening up a little bit more about their emotions. And that can look like months after they've actually rung their bell. So normal will look different than before. And that's why we really want to emphasize that it's reestablishing what normalcy looks like for teenagers. And also, normalcy will look different from family to family and from teen to teen. So, at this time, we also want to acknowledge that a child's diagnosis not only impacts them, but also impacts the family unit and the caregivers as well. The adjustment off treatment can also be an emotional experience for you as caregivers as well. As teens, um, as with our teens, parents can also transition to life after treatment, and this can be both physical and emotional. We want to take this time to acknowledge the caregiver experience. So, starting with emotions and vulnerability, processing the cancer experience can look like feeling emotionally raw. On one hand, there can be positive emotions of finishing and completing treatment. And then on the other hand, there can be some negative emotions too, such as worry, sadness, or fear. Um, After being in survival mode for all of treatment, there can also be a sense of grief after everything you went through as well. To take a minute and pause after all of the treatment has completed, and to start to realize really what happened and what you went through witnessing your child go through treatment, but also what your family has gone through as well. Hypervigilance can also look like the possibility of constantly looking for other signs and symptoms to ensure that your child is safe. And so some of those, there are lots of different emotions that can come up for you, especially at the end of treatment and as you transition off of treatment and establish your own normalcy as well. There's also a physical adjustment with coming to the hospital less. You might be commuting less or spending less time on the highway coming to SickKids or to your respective medical centers. Um, There might be a physical element of saying goodbye to the team a little bit. Many families report that they feel like the team is a bit of their second family because of how frequently they see them. So just acknowledging that there is a bit of that distance that forms, and that distance can have also an emotional impact. There might be a logistical element as well of potentially going back to work and what that looks like for you. Going back to work physically, having a routine, establishing that routine for yourself, and maybe even navigating some of those conversations with peers and colleagues. Family roles. Um, how is everyone interacting again? Maybe there are other family members at home. Maybe there are other siblings or caregivers at home that you're now interacting with, and having to kind of come back into that, come into a role that you previously had, but it looks different. And also, lastly on this slide, just talking about witnessing and watching your teenager go from being more dependent during treatment to being a little bit more independent, with them establishing their own schedules and their routine again. And so having that shift happen where they were very dependent potentially, and having a little bit more of that independence too. Our slides stuck?
Yep. 1 second.
Okay, no problem. Maybe a nice time to take a small break just because we're saying a lot of information.
Okay, 1 second here. Okay, are you able to see them again?
Yes.
Yeah. Okay. Thank you, everyone. Sorry about that.
Perfect. And so this brings me back to the supports that we have available for our patients and our caregivers off treatment. And so it's been roughly a year since this After Cancer Treatment or ACT initiative has also been developed. And this is really around providing that support to our patients and our caregivers. And so it kind of looks in three different areas. So we have individualized sessions, whether that is time-limited counseling or social work support, um, that can be done in person or over the phone, or during a clinic visit when you're there. But this is just around that individualized support of talking about your needs, getting to know where you're at with your coping and your overall mental health, especially as you transition off of treatment and are adjusting to this new phase of life. Um, we are hoping to run a few more groups as well come the fall. And as we continue to develop this program, um, having some more established groups that are patient and also parent focused. So we did run a teen group last fall, and it was quite successful. And so we're hoping to have some more as well. And then also with resources. This includes resource navigation, whether that's in your home communities or in the community of your choosing, community referrals to any programs or any supports that would be beneficial to you as well. So in addition to that, there are, as Becca kind of mentioned as well previously, we do have the Guerin Family Psychosocial website. And so if you are interested in learning a little bit more about the specific time, there are some resources available on that website as well. We also do want to highlight very quickly, sorry, Becca, that again, as Becca previously mentioned, ACT is a SickKids specific program, but if there is anything that you're wanting to talk about or additional support that you are looking for, whether that is for yourself or your team, please reach out to your respective medical teams, whether that is your social worker or someone that you just feel really connected to at your medical center, and hopefully you'll get some additional support there as well.
All right, so I'm going to now talk about tips for caregivers. So we do want to talk about a few things today from a healthcare perspective about how you as a caregiver can support your teen with cancer. And so the big thing here is to remember that the teenage years are about building a self-identity and gaining independence. And so being aware of normal adolescent development and how it can be impacted by cancer is really helpful. Your teen is changing both mentally and physically as they get older. Even without the added impact of cancer, this can create tension between you and your child. As frustrating as it can be, it's important to remember that this is normal. This is normal when it comes to teens. And despite your conflicts and tension that exists, your teenager still needs you to help them grow into a distinct and independent individual. And so as teens move through adolescence, they become more independent. They will start to think in more abstract ways and begin to figure out their own personal morals and values that are often influenced by the people around them. They may start to assert themselves, whereas before they may have previously gone along with whatever was asked of them. Having cancer can also make your teenager's development and your role in supporting it a lot more complicated. We do not deny that. This is a very tough role that you guys have. It can be difficult to manage the tension between your teenager's desires to be a normal, independent teenager, and then also the reality of being a cancer patient who needs extra support and guidance and observance. Impacts of their treatment also might make your teen more reliant on you for aspects of their care. And so with all of that, though, it's really important to support independence as much as possible. You want to encourage your teen to spend time talking to their healthcare team alone with each appointment to give them space to talk about things that they wouldn't talk about in front of you. It's good that at least that they're talking to a trusted adult and being able to have someone to talk about things with that they might not want to talk to their parents about. Involving teens in decisions about their healthcare is also very important. There is a desire oftentimes to have a protective nature and want to protect teens from some of these decisions. And in some ways, sometimes that is the correct thing to do. And then in other times, it's important to still involve them and ask what they want their involvement to be. For every teen, it might be different. They might want mom and dad making decisions about their healthcare. They might want to be involved. They also might need encouragement to be involved. And so just exploring those with your teen can be a very meaningful conversation to have as a family and relieve some of the tensions that might exist. Teens, like I said, are experiencing a lot of emotions. And so labeling, normalizing, and validating the emotions that they're having is important to help work through some of those emotions and then also reach out for help if needed in processing the emotions. As your healthcare team, we are always here to be able to talk with your teen and talk with you about some of the concerns you might have with emotions and mental health. Maintaining a routine is very important. As much as possible, having some sort of routine, whether it be getting up and having breakfast together or going to bed at a decent time, routines are important. And routines are very disrupted when it comes to cancer. And so even a few little aspects to a daily routine can be really important in giving your teen tasks to do and keeping them motivated. During hospital admissions, I really strongly, as a bedside nurse, recommend that you take breaks from your teen. So especially with the long admissions, giving your teen some space is really important for both of you. Remember that when you are at home, your teen is probably not sharing a bedroom with you. And so they do need that space to have time on their own, have a little breather. And then you as a parent also need that space to have a coffee, call a friend, have some time away from your teenager. Encourage good sleep hygiene. This is really important in the hospital, but really important at home too. Sleep is important for recovery. It's important for managing fatigue, which is a common side effect of cancer treatment. And so encouraging your teen to put the screens away, go to bed at a decent time is really important in their recovery. So a few other things. Open and honest communication is key. Involving them in conversations about their health is very important to establishing trust with your teen, and then also encouraging them to be independent young adults. I always say to talk with your teen about the pros and cons of social media. Social media is a great resource that connects a lot of people, but it can also have some dangers. And so having conversations with your teen about what they will and won't post about their health on social media is very important to facilitating some healthy conversations about their cancer, but also ensuring that some tricky situations don't come up. As a parent, it can be helpful to maintain realistic expectations. Expectations often change when a teen has cancer. Their physical abilities can change and can impact how much they're able to help out at home. Expectations for school attendance change, and also the performance that they're able to do in school. Expectations also related to attitude and behavior might also be different. Pain, side effects of cancer treatment, and the medications that they're on can all impact a teen's behavior, making it all the more difficult to set expectations. And so even though it's incredibly challenging, having realistic expectations is important for your teen, yourself, and other members of your family. Setting expectations and boundaries shows that you trust and believe in your teen's abilities, even though they are ill. As well, consistent positive discipline remains important. So working to develop expectations as a family with the understanding that these will need to be flexible depending on how your teen is feeling. Choose your battles wisely. During treatment and also into recovery, there will probably be times when your teen will make choices that you don't agree with. I urge you to try to resist the urge to be too protective and remember that they need to learn to make mistakes too. So try to save arguments for serious issues that will have an impact on your teenager's health and well-being. Address risky behaviors. So drugs, alcohol, and smoking can be incredibly harmful while your teen is on treatment or recovering from treatment. And so helping support your teen in making healthier decisions by discussing the impacts of these behaviors openly and honestly can be very helpful. If you have questions or concerns about these behaviors, you can always reach out to your team, and your healthcare team is willing to help facilitate some of these conversations or talk with your teen about risky behaviors. Respect your teen's privacy. For teens with cancer, privacy is often very limited, especially in the hospital. So it's beneficial to give your teen some privacy to help them become an adult. You might find that your teen won't share their thoughts and activities with you all the time, and this can be incredibly difficult for parents when you're worried about your teen's health. It's not easy, but try to find a balance between protecting your teen's health and then also promoting their autonomy. And then lastly, take care of yourself.
Awesome. So with all of these tips, we also thought maybe it would be beneficial just to provide a little bit of a guideline of when to maybe also reach out for additional support or help for your teen. So please reach out if you notice that your teen feels sad all the time, can't be comforted, discloses anything around self-harm, hurting themselves, or just having some of those thoughts. If they feel extra irritable, if they are irritable, maybe their moods swing quite drastically from time to time, or becoming very, very angry very quickly, please reach out for some help in terms of additional mental health supports. If they're on treatment and they refuse to take any important medicines at home or at the hospital, or if they're refusing any treatments, please reach out to your teens. If they're refusing to come to clinic or to the hospital, if you notice that they are withdrawing from peers or interests that they used to be interested in, or really isolating themselves, please reach out. And also, if they're having any trouble sleeping more than usual, please reach out to your medical teams for some additional support. So we wanted to also cover this important topic. Help, my teen doesn't want to talk about cancer at all. So we recommend and encourage being present with your teen and ask what they want to discuss or talk about. And this might look like anything outside of cancer. If they want to talk about a game that they're watching or playing or anything that they're really interested in, talk about that, talk about the weather, talk about other things that are outside of cancer. And really being able to create that emotional safety and that level of foundation where if they do want to talk about cancer another day or some of their emotions, that they feel safe to come to you and talk to you about that. Be open about your emotions, thoughts, and feelings when it comes to cancer. if they feel like you're being emotionally vulnerable with them, they might also be emotionally vulnerable with you. Gently exploring why, what's happening. Maybe they don't want to talk about cancer because it might be too soon. Is it fear? Do they just want to be a normal teen for a little while and not talk about cancer? Gently exploring potentially why they're not wanting to discuss could be also helpful. Explore, are they talking to other people about cancer? Are they talking to some of their closest friends? Are they talking to a medical professional that they might have built a really strong rapport with during their visits to their respective hospitals? But are they talking to someone else about it? And it might not be you directly at the moment, but it could be that they're talking to other people just to start processing what they're going through. Or have they completely moved on and they're wanting from treatment and they're just wanting to move past it all? That might be the stage that they're currently at in terms of their processing. So maybe right now isn't the time to talk about cancer for them. And again, talking about what they want to talk about and being present and creating that foundation and that relationship with your child, your teen, could be very beneficial at the same time. Okay, and so just to provide a bit of a summary, we wanted to just talk about a little bit more of everything that we've discussed today. But a cancer diagnosis doesn't stop your teen from being an independent young person. So, as we discussed, please continue to involve your teen, integrate your teen's voice in decision making about their healthcare and their treatment. And if they have any questions, having the space to really answer some of those questions that they have. Balance, giving space for our teens to be teens, but also providing that guidance when they need it. Encouraging your teen to do some normal things. And as we mentioned, if they're feeling well enough, seeing friends, going out, having some fun with their friends can help make a difference in their well being, feeling quote unquote normal as well, and have that baseline normalcy and boost in their mental health too. Talk about normal things. Not every conversation needs to be about cancer. So, if there are other things that they want to talk about them. Talk about the things that they're interested and the things that make them unique as a teenager and also what they're going through. Be honest. Try to open up about your feelings and we encourage you to talk about how you're feeling potentially with your teenager so that they can also feel vulnerable with you as well.
And so, just on that note, I always like to say to teens that you are a teenager first. And the second part is that you have cancer. But after cancer is done, you will still be that teenager. And so, cancer is a small blip in the journey, hopefully. And so, we want to focus on who they are as a teenager outside of that. And with that, we just have a few resources that we really recommend. So before we talked about the Teens About Kids Health Cancer Learning Hub, the Children's Oncology Group has a number of great resources as well. The Guerin Family Psychosocial Program website through SickKids, and then the Canadian Cancer Society also has some teen-specific resources and resources on supporting teens with cancer. And then thank you everyone for listening. These are our emails if you have questions for us related to supporting your teen with cancer. And then I think we have a couple minutes for a question or two.
Thank you very much, Becca and Benita, for this very interesting and informative and important conversation. I'm just going to stop the sharing so we can get some questions. If anybody has any questions for Becca or Benita about this, if any of this resonates with you, any suggestions or questions you might have, please feel free to chime in or type them in the chat and we'll read them. I really thank you for addressing that one question we had gotten in advance, which was about when a teen doesn't want to talk about cancer, what do you do? So thank you for including that as well. Any questions? Okay, thank you. That was a very helpful presentation. Thank you, Jen and Jer. And I did want to mention while people might be thinking about questions, I do have a question, and it's for teens who whose journey hasn't ended, whose treatment hasn't ended, and have to transition to the adult care system. And I know a lot of parents have anxiety about that, the differences between being in this, you know, cocoon of familiarity at SickKids going to a brand new system. What do you suggest for them, or what are your experiences with that?
So it's very funny that you mentioned that, Sarai, because that is some work that I'm working on right now at SickKids, to try to explore the experience of transitioning to adult care, because it is very different than pediatric care, and oftentimes we don't do a great job of preparing families for that. And so I'm currently doing a quality improvement project at SickKids right now to explore more. And so if there are parents on this call that do have a teenager who is going to be transitioning to adult care in the near future, who is transitioning to adult care presently or has recently transitioned, I would love to hear your experiences, because I think that this is a important topic, and at SickKids we're really wanting to try to improve this process to have clear expectations when going to adult care and prepare our families better.
Great, thank you. We did get a question here from Kim. She says, I don't want to be overbearing when she leaves for university in September, asking about pills and exercise. Is she eating healthy? Any advice for a parent whose child is going away?
Yeah, great question. Definitely, I think it really also depends on your relationship with your kid, with your teen, especially if they are very organized. Maybe just double checking, like, hey, you know, how are you feeling about some of these life changes, or how are you feeling like you're going to be able to manage some of these things? You know, maybe even acknowledging, like, hey, I don't want to sound overbearing, but what are you planning on doing? Tell me your plan, or even just saying, hey, I'm a little worried. Is there anything that I can help with? So maybe opening up around your emotions too, and starting to lead with that too. In addition to that, it really just depends on kind of your trust with your teen, and if they're going to be a teen, they also might learn a few things as they go along. Of, oh darn it, I didn't work out today, or maybe experiencing what it feels like to not eat the healthiest for a little while, and understanding what that might look like for them, but also just those gentle reminders of, hey, is there anything that I can help with? Is there anything that, you know, are you eating healthy? What does that look like for you? And just asking some of those questions around what the teen thinks about what health might look like for them, or what they're planning on doing, and especially with the adjustment of going to school. Hopefully that helps.
I think also in line with that, being open and honest about what you are concerned about with your teen, letting them know, like, hey, we've been connected for a long period of time, and cancer has made me have more concerns that I might have not otherwise had as a teenager. I do want to respect your independence, but I am concerned about X, Y, and Z. And so how do we work together to be able to have communication that eases my concerns, but also allows you to have independence and make decisions for yourself when you go away to school.
Great, thank you. And Becca did put in the chat there, for parents interested in talking about the transition to the adult care experience, please feel free to email her at her email there to share your thoughts. I did want to mention on our YouTube channel, it's youtube.com/@opacorg. We do have a couple videos that parents might be interested in from previous speakers. We have one from Pogo about transitioning their school and work transitions program, which is a counselor, and she helps kids who are going on to post-secondary or even careers after high school to transition and help with that, finding scholarships, finding jobs and work. So that's one you might want to check out. And we do have one as well. I think she was, forgot now her name, but from Princess Margaret, and she did have a presentation about preparing your child for transitioning to adult care as well. So that's on our YouTube channel. And there is another resource we know about called Upopolis. I don't know if you guys have heard about it, which is a really good resource. It's like a facilitated little islands, they call our groups, where teens or kids really ages 10 to 18, they can talk to other peers who are going through life-changing illnesses, and it's a secure environment run by a child life specialist and other healthcare professionals, moderated, safe space for not only the child going through the illness, but also for siblings as well, which is important. So that's another thing, another resource I thought about, UPopolit. Yes, upopolit.com. Thank you. Yeah.
I think there was another question just about regarding school. Do we have the chance to have an additional year for high school? So regarding this, I think if there is any questions around school, please also reach out to your interlink nurse who might be involved just throughout all of treatment, and they do provide some additional support off of treatment too, especially as our teens navigate what it looks like to go back to school. So if there is an interlink nurse, please feel free to reach out to them, as they do liaise with school and can talk a little bit more about the available opportunities and options specific for your child. Yeah.
And if you have any questions, I know there's a lot of information, please feel free to email either OPAC or Becca or Benita with those questions, and we can send you the links and more information on those programs. So are there any last questions before we wrap it up? Okay, well, thank you for joining us tonight. Again, if you think of anything else, just feel free to email OPAC or Benita or Becca, and be sure to check out OPAC's website, opacc.org. We have a lot of great resources and information there for parents and caregivers. And we also have a virtual drop-in support for parents every Tuesday evening as well. There's more information on that there. So thank you so much, Becca and Benita, for joining us tonight. Excellent presentation. And we're so happy to have you. Thank you, everybody saying thank you, thank you. So thank you.
Thank you.
Have a good night, everybody.
Thank you, everyone.
Thanks. Have a good one.
Thanks.